Hello and welcome. I'm Professor Duncan Maskell, Vice-Chancellor of the University of Melbourne, and I begin by acknowledging the traditional custodians of the lands on which the university and its several campuses stand. The Wurundjeri people, the Boonwurrung people, the Dja Dja Wurrung people, and the Yorta Yorta people. I pay my respects to all Indigenous elders, past, present, and emerging, and to any Indigenous people watching this. I was fortunate enough to open the last episode of Conversations on COVID-19, a global view, with Dr. Tony Fauci. And it is my absolute pleasure to be here again, welcoming you to the second installment of this series, with another very impressive selection of guests. On that note, I would like to welcome Dame Sally Davies, the first woman master of Trinity College, Cambridge, and our own Dr. Jason Thompson from the Melbourne School of Design to today's panel. Being our international speaker today, can I say that Dame Sally is someone that our university holds in very high esteem. And indeed, it was only a little over 2 years ago that we conferred on her our highest mark of esteem, the degree of Doctor of Laws honoris causa, at a special ceremony held in Moot Court at the ceremonial heart of the university in what we call the Old Quad. That ceremony recognised Dame Sally's extraordinary contributions to public health as Chief Medical Officer of the United Kingdom and in such vital areas as antimicrobial resistance. The event took place just before I commenced as Vice-Chancellor, so very unfortunately I missed it, but it's great to be part of this exciting event today. Thank you also to our host and my close colleague, Professor Shitij Kapur, for moderating the panel today. As 2020 comes to a close, there are so many challenges we have faced and continue to face. What is perhaps so unique about this global crisis in particular is its situation in the realm of digital technology and data. Today's discussion prompts a very important question on how we might use that technology to combat future public health emergencies. I very much look forward to hearing today's expert speakers tackle these difficult and important questions. Thank you very much for watching.
Thank you, Duncan. And hello, my name is Shitij Kapur and I'm the Dean of the Faculty of Medicine, Dentistry and Health Sciences here at the University of Melbourne. Now, as we close this most momentous of years, it seems that we can see the light at the end of the tunnel. Now, here in Australia, the case numbers are low, almost near elimination, and vaccines are in sight. So just as you are thinking about the end of this pandemic, the scientists are thinking about how to prevent the next. Now, usually when you think about bacteria and viruses, you think about treatments and drugs. But in the virtual world that we live, data plays a very big role. So the question today is, how can we work together across the globe to use data and analytics to prevent the next pandemic? To consider this question, we welcome Professor Dame Sally Davies, who's the Master of Trinity College, Cambridge, and the former Chief Medical Officer, and Dr. Jason Thompson from here at the University of Melbourne, whose recent modelling work played a significant role in the 110-day lockdown in the state of Victoria, which delivered the elimination of the virus. Now, we'll also be able to take your questions and answers, so please do use the Q&A function and we'll try to get them, and we can. So let me turn to you, Dame Sally. You looked at all of this challenge and you've announced a Trinity challenge to prevent the next pandemic. Tell us about it.
Thank you for the generous introduction, and it's great to be here with you and Jason. Well, the Trinity Challenge is a unique global partnership of academics and private sector, because we recognize that data matters a terrific amount to how we respond, but also how we pick up signals that there's a threat, explore it, prevent it developing into a pandemic, how we respond now, how we would respond in the future, and how we recover better. And that, of course, needs data, not just as governments have access to in general of health usage and deaths and infections if you're testing and how many are traced, but actually much broader behavioral data. And we can go into that. But we need it in a timely and granular fashion so that you can nuance how the world is moving, how people are behaving, what's going to happen. Because after all, it's only with real-time data for this sort of problem that we can act quickly and learn fast. Well, so the Trinity Challenge brings people together to solve these problems.
Thank you very much, Sally. And now you're talking about challenges at the global level, but Jason here, you helped us at our challenge right here in Melbourne, Victoria, which first, of course, led to our 110-day lockdown. Not that all of us liked it,
No.
but it then led to the elimination. So tell me how your approach was different.
Well, our approach was, most people are asked in this pandemic to think about the start of the pandemic, how to prevent it. We were brought in at the tail end, so we were really thinking about how to exit it safely, how to stop that oscillation pattern that we're seeing in so many countries around the world. So it was a very different thing to be brought in the last sort of month to 2 months of the pandemic. So we were trying to stop things from happening. I suppose the other difference about what it is that we were doing was we were very, very policy focused. So it was all about providing evidence that policymakers could use very, very easily. That was the difference in the modelling that we produced.
Look, I think we have a feast of wonderful questions going from the global to the local. So let me return to you, Sally. You call it the Trinity Challenge. How did the idea arise?
Well, I was discussing with colleagues from mid-March through those few weeks what was going on and what was needed. And we started to ask ourselves, what do we wish we'd done 5 years ago to put us in a better position so that we'd have picked it up early and it never spread, so we'd respond effectively and not be where we are now, so we'd recover well. And then as we thought that one through, we said, hang on a minute, science has moved on, and the way it's moved on is about data and what data is there and how it's used. You only have to look at artificial intelligence and model building to realize how much it's moved on. And yet Britain was basing its response, at least the beginning of it, on a 13-year-old flu model. And we thought maybe we could do better another time. So we thought about that and we debated, what data did you need? And you do need behavioral data. You want to know, what are people doing? If they're told to stay at home, are they moving around? And if so, where? Are they going into restaurants, cafes, pubs? Are they traveling? Are they spending money? And if so, are they spending it from their homes or elsewhere? So all this behavioral data. And we realized the governments don't have that data. It sits in the platform technologies. So then the challenge we faced was how to bring these different sectors together, public and private data, and get people to answer the questions that are posed.
Now, I couldn't help noticing, Sally, that it's called the Trinity Challenge. I presume it's because you from Trinity College led it, but it also poses 3 big questions. Can you tell our viewers what those 3 big questions are, and how will the people respond to your Trinity Challenge?
So we've set it up to do 3 big things. One is, across the membership, work on the data they have to answer the questions. Another is a public challenge that opened mid-October, and we've had more than 90 applications to join in. And the third is some think pieces. So what are we learning as we explore all of this? And the 3 big areas we're asking people to have a look at and see if they can give new thinking based on data are exactly that: identification of a threat. Because ideally, you want to see a spike and look at it and say, no, not important, irrelevant, no, no, no. This could be something, let's do something about it. So that's one bucket. How do you do that? And most people would say surveillance, and lots of people think we should set up massive zoonotic surveillance across the world. And I predict it'll be too expensive, and even if it starts, it'll fall over because politicians won't go on funding it. We're also interested in response. How do you have real-time data to manage your response, both in hospitals, in the community, and as a society? And then, of course, how do you manage recovery, which is not just medical, it's social and economic. And so those are the big areas, and we invite people to come into our challenge and on the website say, I want to work on this question in this way, to give us a plan, tell us what data they need, and then we'll match them to the private sector or others who have the data and have offered architects, data architects and people to help solve those problems.
So Sally, it seems you provide the data, you link people together, but actually if one goes to your website, you also provide funding for research.
No, we're going to provide prizes. We are looking at providing some funding for something on vaccine hesitancy, but that's different. We don't fund the academics. The academics have to use their own time or their grants, but most of them, you know, with the promise of a prize and actually wanting to do something and having access, privileged access to data they couldn't have got otherwise, are really interested. But interestingly, we discovered that the academics, and I don't know whether Jason has found this, don't know what data's already available, what they can have if they ask for, let alone the privileged access issues. So we've set up a data catalogue as well to try and help people, whether as part of the challenge or separately, access and find data. And we've also brought in recently as a member, Swiss Re, who with Palantir have set up a wonderful data lake with a lot of interesting data.
Now, speaking of data, and you know, one of the objectives of the Trinity Challenge is how do we cut through what you call the infodemic, which is the huge explosion of information of all quality, which has actually accompanied the pandemic. And tell us a little bit about your thinking about the infodemic that came with the pandemic.
Well, I think we've had vaccine hesitancy, as we know, for quite a while, and we've had echo chambers on social media. But all of this has come together and seems to be getting bigger. So we need to see how we can understand it, but actually also intervene. And one of the projects I'm really excited about is two of our members coming together to work on this, Facebook and Internews. Internews is an NGO of 70, working in 75 low-income countries, trying to get true news over to communities. And they understand what makes for trust in those communities about language and how close the people are and are they village elders. And so they're working together with Facebook, looking at how Facebook can alter some of its messaging and evaluating. They've brought in some academics to evaluate the impact and everything, because Facebook's given lots of free kind of advertising or messaging to World Health Organization and others, but feels it's not getting the messages over. Meanwhile, another side of it, Facebook's working with other academics to look at their regular surveys that they do of people, how they feel about COVID, what symptoms they're getting and things like that, to try and extract that data. And that's interesting on its own. But when you marry up, are people wearing masks? What do they say they're doing on these surveys with the database that's been established of government mandates, where the Institute of Health Metrics are working with the Blavatnik School of Government in Oxford and Microsoft employees who are all, every week, sending in what's happening all around the world in their governments on mandates, then you can start to say, this is the mandate. This we get from Facebook, and later we hope Tencent, of what people are doing. Oh, and here are the outcomes, you know, from the health data. And you can start to see, if you change one thing, what happens elsewhere.
Now, one wonderful example, Sally, of where it has all come together and produced results, of course, is here in Melbourne and Victoria. Now, to those of you who live in our wonderful state, you probably know the story, you've felt it, but for those of our viewers who are around the world, it's good to remind you that about 4 months ago, Melbourne was in a complete lockdown. We had 7,000 active cases. And today, for nearly 5 to 6 weeks, we've had no local case. I don't know of any other city in the world of our size that reached up to 7,000 active cases at one point in time to have come down to what you might well say extinction of the virus or eradication of the virus from our local community. So it happened for a number of reasons, but one reason it did happen was that there was very good modeling support, and that came from the group that, Jason, you were a part of. So tell us, how was your approach different from the approach elsewhere?
Our approach was different in that we, in order to tackle this problem, we looked at it from lots of different ways. So the model that we used, a lot of people sort of seem to think it came out of the blue, but we'd actually been working on the model for about 6 months prior. We'd actually tested it on whole of Australia, we'd tested it in New Zealand, and we'd had some predictive, it had been predictive of what had occurred in New Zealand. We predicted the elimination there to within about a week, and then we also suggested that Australia would go into a second wave because in our view in the modelling, which was a reflection of the society, we hadn't done enough to suppress the virus to an extent that we could then release to the extent that we wanted to before hitting into a second wave. So we suggested that we would head into a second wave. Unfortunately, it happened in our hometown of Melbourne and Victoria, and we were subject to it. But so we had tested this a little for a while. Now, my work is in agent-based modelling and computational social science. So a lot of people were sort of saying, "Oh, what are you doing? You're a transport researcher, aren't you?"
That's right. So your daily work before you studied transportation dynamics and traffic and things like that.
No, there's a healthy rumour out there that that's what I do. I'm actually not. My PhD was actually in medicine, and it was in and my master's is in clinical psychology. So I study human behaviour. So the transportation interests that I have are in the way in which people interact in a transport system, and especially the way in which people who have had motor vehicle crashes then go into the health system and interact within the health system. So I'm very interested in modelling complex systems. Society is a complex system, health systems are complex systems, and I'm very interested in the way in which humans interact within those systems and the way in which they respond to policies, top-down policies at an individual level.
So your model not only incorporated the virus and how infectious it is and all that stuff, it also incorporated how individuals will react and where they'll listen to Dan Andrews' news and change their behaviour.
Exactly. So the whole point of our models is around heterogeneity. So it's appreciating individual differences and the way in which different people react to different things. Some people will get tired of listening to to the messages. Yes. Some people just won't wear masks. Some people will have to go to work. Some people won't comply with quarantine orders. Some people will have to go to school because their parents are essential workers. So we can include all of these different variables.
This level of detail.
Correct. So there was about 60 different variables that we worked. So we had epidemiologists on the team. We had psychologists like myself. We had economists. We had computer scientists. We had geographers. So it was a spatial model. It was a biological model. It was a behavioural model. We had all of these people looking at it differently, and it was the combination of these things together that was so powerful in trying to get a complete picture of not only what had occurred, but what was possible in the future. Remembering that we were projecting not just what might happen next week, but 2 weeks, 3 weeks, 3 months out.
But Jason, in many ways, what you're talking about is when common parlance, when anyone asks a complex question, they say, well, it depends. And then they say, it depends on this, and it depends on that. And you're now telling us that you can put all of that depends in the mathematical model.
Yes.
But where do you get the estimates of how many people will wear the mask? How many will get tired? Tell us.
So and this is a really interesting question around around data. So the limitations of data as well, the limitations of collected data. So you can look at history, and that will tell you so much, and you can and it will give you an idea about how people might behave in the future. But at some point, you're launching off. At some point, you're launching off into the future, and you have to then work with experts who can sit around and come to an agreement about, okay, well, we think these patterns might appear in the future. We think the population will split like this. So you're incorporating theory and the data.
The expert predictions.
That's right, because data, and especially in an unfolding crisis where we were under intense time pressure to produce the results that we did. It was very clear. There were times where if we didn't get something done by 5 o'clock, that would not go to the health officials, to the people who need it, and where would we be?
But you know, things change. I well remember that in May there were these discussions. Oh, mask wearing? No. Asian countries do it. You know, in Australia, no. You know, we don't wear masks. But yet, and that was the same thing said about America. But 2 months later, you could see in Melbourne and Australia, we made almost a complete switch to very high levels of compliance, whereas in the US, it doesn't seem to have happened.
Yep.
So, were you able to anticipate this?
Well, I suppose what we were trying to do is to try to anticipate that, but we didn't see in Australia. It didn't have the same level of bipartisanship, if you like. We, especially at the start of the pandemic, and I think this is if there's a lesson that comes out of it. At the start, when we had all state and territory governments and federal governments working together, they were all on the same page. Everyone was in it together. You know, the response of Australian governments was outstanding, and we outdid ourselves in that. It started to crumble, you know, in about June when there was one poor little state who wasn't doing so well, and then we started to see the splits, and then we started, you know, it started to, you know, bifurcate, if you like. But when people were working together, it was an extremely effective public health response that is a model for how things should be done.
Now, just to sort of bring this to a close, and so that those who've not followed it actually knows how closely real life can follow predictions. Tell us, you made your projections about when the virus might hit zero. In which date? It was somewhere in August.
It was late in August. So it was about August 29th when we finished the modelling.
And that model on August 29th said that if you follow this and this and go through our stages, on what date will the virus be close to zero?
Around the 20th. Well, we said that we would hit under 5 cases, a rolling average of 14-day rolling average.
Yeah, we remember
Everyone
that.
got into those, of less than 5 cases on or around the 26th of October. And we were pretty much on
So you could
on
predict
that mark.
3 months forward, this very complex behavior would evolve. Well, thank you.
Well, it was an average, so
Yes,
you know.
well done. But I think what you also pointed out is that while numbers and data and modeling are important, actually the political buy-in into converting that into policy and directions, and then finally the populations buying into it is as important. Because, you know, one thing good about science is that you've spoken to your colleagues in London and New York, you've shared your models. If it was just about getting the model right, they could have quickly followed your model and we could have elimination all over the world, but it hasn't happened. Now, Dame Sally, in your current and previous roles, you've worked very closely with politicians. In fact, those of us who were in the UK would often see you on TV trying to explain these complex things. What's your understanding of how data, particularly in this pandemic, has worked with the politicians and the other way around?
So I want to start by giving Jason lots of credit. I mean, I saw it from outside, but that's exactly the type of thing that we think from the Trinity Challenge that people should be doing more of and understanding. And I don't think we saw either the political harmony that you had at the beginning, national and local government, or across the parties, let alone the kind of challenge and working it through on the behavioural and psychological side. So data and governments. We have a government that gets very excited about data, but you can only use it insofar as you have the tools. And we have a system, the Scientific Advisory Group for Emergencies, supported by a group on modelling, and it brings together some of our top modelers. But they definitely did start both with limited data. So you'd think we'd have good data, but we knew from flu and various things that it was not as good as it should be. And they were using flu models. And it's been a very difficult journey. We got another group of scientists setting up the alternative SAGE, contrasting and saying they'd got it better, so that we ended up with kind of talking heads of scientists disagreeing with each other and politicians saying we follow the science, so that one of the casualties may in the end be science, because is it that the politicians will lay the failings of where we got to and are at the feet of the scientists, or will they accept their role in it as well? Very complex mess here.
It is. And to put our success in context, it would be fair to say, and Jason, you'd agree, that in August when you came up with your model, the entire scientific community was not in harmony. No, there were many who said, look, this is too austere a prescription. And there are many who said that despite your austere prescription, look around the world, no one's been able to get down to extinction levels. Why are we even trying? Because we're imposing so much economic damage. But look,
exactly.
It's worked out rather well for us. But I think in our success, it'll also be perhaps worth looking at some things that haven't worked out as well. Because there was a lot of excitement about this contact tracing apps. Let's not forget that 6 months ago, all the countries were excited that, this old business of picking up the phone and asking who have you had lunch with and no, we'll just do it through apps. What is your sense of how that's worked out?
Look, I think people are, I wouldn't put vaccines exactly in the same sort of techno-fix basket, but people are obsessed with, people like pills. People like, I can still go about my normal life. I want to live my normal life, and I will just have this thing, and then
my smartphone will protect me.
It will just save me, and I won't have to worry about it. And I think that, there was a description that the COVIDSafe app was like sunscreen. Just put it on and you'll be fine.
Yes.
And we had actually done some modelling around it in our existing model, and sort of said, it'll work a little bit, but it's not perfect, especially at the level of uptake that we were getting. Sort of seeing. Yeah. And even in the in the restrictions around who was contacted, within that, you had to be in proximity of someone for about 15 minutes, et cetera, et cetera. So I think it was used. Perhaps it was used as a solution. Look, we've come up with this solution for you. You don't have to worry about it anymore. Go back to your normal life. So I think it just broadly falls into this techno-fix bucket, which makes us all feel good and makes us feel like we don't have to worry about anything anymore. Right. Which is certainly not the case.
Now, Sally, is a similar app also making rounds in the UK? Was an app like this? Or people ask.
There is an NHS app. It's on at least its third version, and many people do use it. But again, it is this idea of a technical fix. There's no doubt that now our test and trace service is going back to a much more old-fashioned method of using local public health and safety people to do the checking up. And it's a big job when you've got as many cases as we have across the country. And only as we bring it down will it really be effective.
Right. Now, while I'm talking about this app, to put it in balance, I think I should recognize that there was another app which wasn't doing contact tracing, but was just asking people to report their symptoms. And that app was very effective because it actually picked up that this loss of smell that is distinctive to COVID is seen by a lot of people. So, there are obviously places for apps and technology, but the one thing that has surprised me is almost the universal difficulty with implementing a test and trace system in our very advanced societies. So we have great hospital systems, we can do very complex things, but just getting what to an outsider would seem like a relatively straightforward, you test people and then you trace their contacts and you test them. It wouldn't have seemed so difficult, but it's turned out to be fiendishly complex everywhere. Your thoughts in Australia?
I think here, because you have such a surge workforce associated with that as well, there are practical issues around, how you employ people. We've got, at the moment, I think we have over 1,000 people who are contracted till next year and they're not kind of really doing anything, Right. So it's a workforce issue as well.
Right.
You have to be able to employ people, you have to be able to get them trained, you have to be able to get them ready for something that isn't here. And then, this sort of public health the prevention paradox was like, oh, well, why are we spending all this money on this?
Right.
We should deploy them somewhere else, deploy them to emergency or something like that. So there's all these interacting systems and challenges that make the seemingly simple far more difficult practically,
it does.
Especially over the long term.
Right. Now, Sally, of course, in the UK, this has been the subject of many political promises and billions of pounds. Why do you think it has been that difficult?
Well, I would agree with Jason, but as a hematologist, I used to run a lab. So let me explain that actually it's not that easy to do these tests. And you do have to get the right equipment. And so then there was a call across Britain to pull in the right PCR blocks from research labs. And then you have to train people and you have to do quality assurance. And, to set that up in peacetime for a small lab might well take 6 months normally. And if you rush it, 2 to 3 months. But when you're trying to scale it as well to the numbers that we were trying to do, that was a terrifically difficult task. And in the public eye. So I do think it was extraordinarily difficult. I personally would have made sure that the public knew how difficult, and I'd have set out what we were trying to achieve and explained, if we did, how well we'd done, and if we didn't, why we hadn't. Because I think it was that lack of transparency that made it very difficult for people. We were being promised things that weren't delivered, but we didn't know why. But it has proved difficult. We actually have in Cambridge on a joint lab between AstraZeneca, the medical school, and GSK that's it's called a lighthouse lab, doing masses. But to scale that up, even using industry, has been quite hard work. And of course, if you look at the difference between countries, in Britain, we tried to do it through the NHS with help from outside, but most of it is NHS driven. And do we have the expertise? Whereas Germany, that did rather well, has a much more regionalized system. And then on top of that, they have far more private labs and things. So they were able to flex upwards much more easily, it turned out.
Yeah, so, I mean, it's an interesting thing you raise about how we've talked about how academia and scientists work with politicians and government. But Sally, you're drawing us to, of course, the very important role of the private sector in all of this. So this takes me back to your Trinity Challenge, because I went and looked at your website. So not only do you have data from governments and WHO and hospitals, you've also got data from a restaurant app called OpenTable. And I was very eager to see what's happening to restaurants around the world. And I think our viewers here in Melbourne would be quite pleased that we are leading the world in Australia in the reopening of restaurants.
Very Melbourne.
Very Melbourne. But you also have data about mobility from these apps, which actually give you directions. And City Mapper is the one that you have data. And I was rather surprised that Singapore is nearly back to 100% mobility. Sydney is at 50%. Melbourne is at 40%. So I was quite amused that we're moving around only 40% and yet eating all the restaurant meals that we ever used to. But the more important question is, how did you engage and encourage the private sector, which is very precious about their data for competitive reasons, to start sharing their data? And how do you think this could go further in the areas of health?
Actually, everyone was very positive. I rang them all up and said, this is the vision, this is what we need, and surely you have a role to play. And I don't think we got anyone who said, no, they didn't have a role to play. Some of them said, oh, I'm a bit busy at the moment, or whatever. But no, they all recognized that they held data that could be depersonalized. And some of the more deep data has to be used under privileged access, where the researchers sign, a legal commitment to protect that data. But they saw the need to bring it together to see whether we can do better. And we can do better. I mean, I bet Jason would love some of the data that's there, and you're welcome to it, to improve your understanding and do better, and then share your models when you've improved them with other people. That's how we will get a good system that really jumps on threats and makes sure we respond effectively.
Now data is very good, but you see, I want to turn to the reality that often when these black swan events come around, or as social scientists now call them, X events come around, almost by definition, they're novel. So we may have data that looks like that situation, but almost by definition, we won't have data on that kind of a situation because it's the first time we've had it. So how does modeling world proceed? Mm-hmm. You know, how do you, in the early stages, when you're still debating, is the R value of this 1.5 or 2.5, what's evidence-based policy when there ain't that much evidence?
That's right. So it's a really good question. And throughout the pandemic, I think we saw people asking the question, where is the evidence for this policy that you are implementing? Yeah. Where is the evidence for the 5 kilometre rule? Where is the evidence for the curfew? Where is the evidence for this and that? And the gold standard that people try to hold themselves to is, we follow evidence-based policy, which really takes its lead from evidence-based medicine. Yes. It should be justifiable. There should be sort of a history of this working, and anything you're doing should work. But increasingly, the sorts of events that are we're likely to see in the future, there's a lot of theory around this, which are these X events, is that they're going to be novel, they're sudden, they're unexpected, and they're potentially catastrophic, and they have a very short unfolding time, but a very long impact time. So, we think about the pandemic, we think about the GFC, we think about, some natural disasters. And so, there's a time-critical point of time where you mightn't have time to collect the data. You mightn't have time to collect all of the information you need in order to make the decision, because the community rightly expects that a leader will make a decision in the best interests of the population very, very quickly. They're not going to, scientists, they're not going to wait for the scientists to do their gold standard trial in order to be involved.
I mean, leaders have done that for the last 4,000 years. They just did it on a thing called a hunch.
Yes, that's right. Intuition. That's right.
And some of them got it better than others.
That's right. But I was going to say that this is why I'm so, I suppose, interested and excited about, in a very nerdy way, about the role that artificial societies and the construction of models and artificial societies can play into the future, because we can start to observe what happens in future artificial societies that we begin to trust as looking quite like our own. So if we can see some of these events occurring in these artificial societies, which have elements that are very similar to our own, we might be able to start to say, oh, okay, here's a parallel here. This is happening. Maybe this will happen in ours, and maybe that will give us a little insight into what's going to happen in the future.
So artificial society, this is like a grown-up man's video game. Is it like you create these worlds with multiple little agents in them, they behave in certain ways, you do things to them, and you study what happens?
That's right. So you include in them all the things that you think are important, the complex interactions that are occurring between people, the policies that you're implementing on the society, the connections, the interconnections between things, and you can watch them collapse. But thankfully, they're not the real society. You can make an artificial society collapse 2,000 times, and it doesn't matter. No one dies, no one gets injured.
Good.
It's fine.
It's a video game.
But you can also say, oh, gee, if that happens there, that really parallels what's happening in the real world. We should be very careful about this, and you can start to delve into that.
So you can identify vulnerabilities. So
exactly.
You can see.
Yeah. So I think Dame Sally discussed before about, is this real, or is this something we should be worried about, or is it not?
Yes.
The study of artificial societies through computational social science and there's artificial intelligence is one thing, but I think artificial societies give us another very, very fertile tool in understanding what sorts of catastrophic events we are vulnerable to in the future.
There we go. Now, this is good. I mean, artificial societies are good, but the point is, if another new disaster comes, we will still need a politician standing on real-time TV making a real-time decision, and it'll have to be quick.
Yes.
And now, Dame Sally, in your roles, you worked with politicians.
Yes.
And they must get this multiple conflicting advice. And it's easy to criticize them, but those are very hard shoes to fill when you have to balance all of those considerations. So give us your thought from the politician's point of view. How does it feel for them when they get all of this data thrust upon them in an uncertain situation, but they've got to make a binary decision? You know, they've got to either close down a city or not. Give us some insight into that.
So it is difficult because they'll be thinking, so what are the advisors telling me and where's it coming from? I mean, I gave up talking about evidence-based policy some years ago, Jason. I talk about evidence-informed policy. I think we have to give them the information, but actually they balance it between the N of one, the story they were told yesterday, the bit they read in the newspaper, how they think it'll play in their party or their constituency, and they balance all of that. And the really good politicians do have a hunch and a feel for it, and they will listen, but it'll be tempered by, you know, their childhood, their understanding of science, their beliefs, and you can actually see it out play out that different politicians are very data keen or rich, and others are shy of it, and some are very kind of this is it, and others are more I'm doing my best, and you do see it play out, but I wouldn't want to be them. These are very tough jobs, and I think the role of politicians in these emergencies, people generally underestimate how tough it is. And this one, because it's not an emergency, it's a marathon, so it's tiring, it's really difficult for them. And a lot of it will come back to trust. Who's telling them? Do they trust them? Were they right before? Where are they going? And how's it put over? And I think therefore it behoves the scientists to be generous to the politicians and give them the space to think about things, to ask questions, and actually on occasions in small meetings to be stupid if necessary so that they get there. But we also need the scientists to think about what's going on. We still do not have a strong mandate on masks in this country. Yet it was clear by the end of May we weren't going to get a randomized controlled trial, and they make a difference, probably a very significant difference. And yet, for some reason, we haven't managed to get that strong mandate. I mean, like other countries, mask wearing is going up, but it's difficult.
I think you do raise a very good point that, you know, no matter how much data, and I'm sure our data and modeling will get better, it will, and perhaps should be, finally a political responsibility to convert all of that information into a binary decision that affects societies. Now, the thing that has impressed me about it, that in May, when Melbourne was sort of going up again, you know, I'd just come down, was going up again, there was a lot of hand-wringing about, oh, you know, Eastern societies, look at Seoul, look at Tokyo, look at Hong Kong and Singapore, you know, they can actually do this, but we do not have the level of public commitment, public compliance. Yet if you look today, we are the only sort of democratic, you know, city this large that has been able to suppress its numbers down to zero. And sadly, for whatever reasons are complex, Seoul, Tokyo, Hong Kong, Singapore are not there. So I think there was a thinking that you need slightly more authoritarian systems to actually suppress the virus. But it shows that good scientific advice, good political decision making, but trust, as you said, probably the most critical ingredient, is probably as important as data in getting people to an end. And what's your sense, and this brings us to this issue of infodemics and communication of risk to public, and probably the public understanding of risk, that is probably as important as just the sheer numbers. So how does your model deal with the public understanding of risk?
So we had both endogenous and exogenous, I suppose, effects in our model. So
tell us what that means. Endogenous and exogenous.
So we Victoria had very strict rules, so you would be fined if things happened.
Oh yes.
So we understood that people would start to, become a bit slack, maybe not wear their masks so much, not social distance, those sorts of things. And that would occur over time, and that would probably be a fairly linear kind of decline. But we also understood that the government had a fairly law and order approach to what was going on. And so there was probably a floor under which you couldn't slide any further.
Yeah, now, Dame Sally, you'd probably not know this, but all of us in Melbourne know the lady who was walking in the botanical gardens when she was not supposed to do that and got fined by the police. And so that probably had an effect for everyone over here, yes.
Right. So there was a limit under which you probably couldn't go at certain levels. And so every time you went down a level, like we went from 4 to 3 to 2 to 1, there was probably, we started out here and we drift down to
Slipped
here.
a little.
So we tried to appreciate those sorts of things. So, but I mean, I think one of the things that was, you mentioned trust before. This is an extremely, this is a social problem. I mean, I know we're talking about it from a medical perspective, but there's so much in the social sciences about this pandemic. If you look across the world, it is a socially, a socially driven issue, whether it's politics, whether it's individualism versus collectivism, all of these sorts of things impacting on the way in which it spreads. And even within Melbourne, we had it spreading differently within different demographic groups who had various levels of trust in, government, in police, etc. And so communicating to those groups became very, very important. And changing the way in which we communicated, because there were certain instances in Victoria where we did it very, very badly. My wife is involved in human rights law. We had some very interesting discussions about, the pandemic versus the human rights part of this. But it's going back to the core issue, it's as much of a social issue as it is a biological issue.
Now, of course, one hope would be that we have learnt from this, Black Swan X event to perhaps prepare us for some of the other Black Swan X events that are likely to come. So what do you think are the learnings we might transfer from this to our next swan, whenever it is to come?
Well, personally, I'm still going back to I think there's a huge role for artificial societies and a huge role for interdisciplinarity. I think that's one of the things that we've really learned. Interdisciplinarity, groups of people coming together. Going back to the question earlier around, people sort of saying, oh, you're a transport modeler, what are you doing in this space? People want to put people in different boxes and you have expertise in here, but I think the thing that we're learning more and more is that complex system studies, the studies of and using interdisciplinarity can be very, very powerful, and that these things come together and we need to work together across disciplines.
That's actually a complex system studies. Now, of course, I'm from the University of Melbourne. I've got to pitch it a little bit. I think, but this is what all universities do well. We're not about single issues. We bring together social scientists with microbiologists, with architecture faculty. Dame Sally, from your point of view, what do you think are the lessons from here that might transfer for us for the next emergency?
Well, I love Jason's set of issues, and I agree. And I actually think that one of the things that we set the Trinity Challenge up to do was to raise different models and understanding and ways of going about it up to the global level, so they're taken notice of. So, Jason, we have to get you in there showing off what you've been doing. I think we also need to learn that if you've got a Black Swan event, you may be able to create different ways of response or types of response in an artificial community, but be careful what you assume as a social scientist about how the public will behave. So we were told that the lockdown was delayed because some social scientists argued the public would not comply. Then we did lockdown late, and they complied, and actually it was then quite difficult to get them out. Meanwhile, we then went into looking at economic stimuli without thinking about, so how does the virus transmit, and is that going to be a good model going forward? So that argues for the interdisciplinarity. What we're trying to do with the challenge is surface good thinking that will help now, but actually to develop also this awareness of where there is good thinking, and so others can either build on that or work together, and the interdisciplinarity is very important, and develop a muscle memory for the future. But I suppose I can't leave it there and say, well, you know, we need to be better prepared for the next one without saying that I've been talking about lobsters. So Shitij, this won't be any surprise to you. I think COVID is the lobster dropped into boiling water and it makes a racket as it dies, and it's dying. But what about antimicrobial resistance, AMR? That's the lobster put into cold water, being heated up slowly, and we're going to die all the same. So I'm rather hoping that the world will realize that we not only have acute black swan events, we have visible slow pandemics, at least one, which is antimicrobial resistance, happening. And hey, it's going to cost us even more than COVID if we don't mitigate and sort antimicrobial resistance. And it's just as complex because, of course, it involves humans, animals, fish farming, the environment, everything. And it's behavior, it's science, it's, you know, you need vaccines, you need new treatments, you need diagnostics. It's more complicated, more ingrained.
And you've, of course, been leading a worldwide effort on this before COVID came around, and it's important to actually check that. And for those of you who are wondering what antimicrobial resistance is, it's simply our antibiotics are slowly stopping to work for the infections that they used to. And this business of just making new antibiotics just can't keep up pace with this. So unless we do something to change the biology of this, we might be in trouble. And you're quite right, it may come slowly.
We are in trouble.
Okay, we are in trouble. I think I should say that rightly.
At least 700,000 deaths a year across the globe, going up every year.
That is true. And Dame Sally, thank you for drawing everyone's attention to that. So I think this brings us closer to the end, but I always like to end on a positive note. So when I look back at almost all the big disasters that have happened to this world, Second World War being a good big one in the recent or the far past, some good comes out of it. There is change in societies. In Britain, the NHS was a product of what happened after Second World War. What do you think might be the positive changes, other than artificial societies and the Trinity Challenge, but leaving that aside, what other bigger, more positive changes can you see coming out of this collective global experience that we've had? Jason, we'll start with you and come to Dame Sally after.
Well, I've answered this on a personal level.
Yes.
Most of the people that I've been in contact with, which has been lovely in the last few months, have really appreciated the small things in life, really started to appreciate, no one in a park doesn't have a smile on their face, the fact that they can go there, the fact that you can have very simple interactions with people again, these were things that we took, for granted, that suddenly we're not taking for granted anymore. I think that there's a really important, there's been a reset in people's priorities around what is important for them. On a more professional note, we're thinking a lot about the role of cities, how people travel to and from cities. If you don't have to come to work, 5 days a week anymore. I live in regional Victoria. I would travel for up to 4 hours a day. If I don't have to do that anymore, and I can be just as productive or even more productive, how does that change our city? So I think that we shouldn't just go back to normal. We should think about it as a chance to fix some of the things that probably weren't working so far in the past. And I think COVID exposed a lot of that, especially in terms of workforce, gig workforce and those sorts of things as well. So we should take it as an opportunity to improve.
All right, so I'm taking away more picnics in your local park, less travel to work. Dame Sally?
Well, I think it has shown the frailty of our societies and the inequalities. I mean, just look at the death rates in those who are overweight, in those who are poor, black and minority ethnic populations, and how we have not attended to health. And so I thought you were giving me an opportunity to advertise the book I published a couple of weeks ago called Whose Health Is It Anyway? Where with my colleague author, Johnny Pearson Stuttard, we talk about total health, the need to pivot and leave our national illness service going strong, but to develop a real total health approach, which is both public health and making it easy to take the healthy decisions, and also social health and looking after chronic diseases, not as illnesses, but as things to be overcome so you get on with life. And then we've made even proposals about how you'd fund it using the private sector to contribute. So there you are.
There you are. Wonderful. Well, I hope after the NHS we have this new N whatever emerging after the pandemic. But with that, it is my sad duty to actually bring this to a close. But before I do, I wanted to remind ourselves of the times that we could travel. And Dame Sally, how wonderful it was to have you here in 2018 when the University of Melbourne conferred upon you the degree. So there you are. This is at the University of Melbourne Quadrangle, and that was my pleasure to be with you. And we are so delighted, Dame Sally, as you tell us that you still wear this gown off and on to some Trinity events. So there is a little bit of Melbourne you've carried with you, and we're delighted to have it. So thank you very much. It has been a privilege for me over this year to welcome so many experts, not only from the University of Melbourne, but from across the globe. We've talked about lockdowns, we've talked about vaccines, we've talked about the disruption to our family lives, to tackling economic outcomes, none of which could have been foreseen at the beginning of the year. And it is thanks to your interest and your curiosity that we've continued. So thank you for your interest, but I have to admit that at this point in time, I'm actually sick of COVID. So let's all take a few weeks off. Have yourselves good holidays, restful holidays. Until we can shake hands again, a namaste to all of you. Thank you.